Hi, I'm Dr. Jamil Smith, pediatric psychologist at Wayne Pediatrics, and welcome to this episode of Detroit Peds Talk. While academic success is traditionally thought of as an educator's or teacher's responsibility, a recent American Academy of Pediatrics report demonstrates that pediatricians are uniquely positioned to support children's academic achievement. So I'm pleased to have with me today Dr. Eric McGrath. He's board certified in both pediatrics and pediatric infectious disease and treats medical conditions like HIV, hepatitis C, and common recurrent infections. He's a trusted colleague here at Wayne Pediatrics and a professor in pediatrics at Wayne State University in Detroit. He brings lots of experience caring for his patients and in recognizing and remediating problems impacting classroom concerns. And so he'll share with us how parents can partner with pediatricians in supporting their child's educational success. Welcome, Dr. McGrath.
Hi, I'm glad to be here. Thank you.
So, Dr. McGrath, what are some health factors you look for that may negatively impact a child's educational success?
From the first visit, when we're seeing newborns in our clinic, and onward, we begin with basic things like feeding and voiding and stooling, and a timely issue with food insecurity is that there's been a formula shortage, as you know, and so we've been working hard to make sure that our families have formula, which is kind of basic if they're not able to breastfeed. Of course, supporting breastfeeding if we can. And then, talking about sleep, how are they sleeping? Of course, newborns tend to have it a little bit upside down for the first few months of life, but they get the hang of it usually. But as they start growing, they get into their sort of 1, 2 year old well visits. We begin to screen more for common issues like vision concerns, hearing testing, and even speech or language delays. And so if we pick up on any of those things as pediatricians, we usually refer the patients right away to an early on type of program, a support program, where they can get those services. Especially those programs are tailored for the most part for children under 3. And a lot of them now that the pandemic is more under control, they actually go out to the homes again and do a lot of the interventions and assessments at the family's home. So I think that's convenient. And
Yeah.
then, as the patients get even a little bit older, more toward either pre kindergarten or into those younger elementary school grades, we begin to work with families if they're discovering that, the patients maybe having a little struggle, having a tough time either concentrating, are they too active, ADD or ADHD comes out, which is more your realm than mine. But pediatricians are usually comfortable treating that along with making referrals sometimes if an actual learning disability might be, in the differential, having them go to have formal neuropsych testing or making those referrals to make sure that it's properly, addressed and assessed at an earlier stage so that you don't get to middle school or high school with the student and have them just, really, deteriorate or kind of collapse with their academics. And I think the final thing is, exercise and physical activity, making sure that's kind of part of our normal screening for older kids. Obviously, once they can walk and run, I guess, more than newborns, but that whole kind of like a holistic picture of the patient, what they're eating, how they're sleeping, what are they doing for activity, all those types of things come into the whole picture. And I think that's what we normally do. That's kind of our overarching kind of bread and butter kind of stuff.
Right. And I like the way that you approach it from a developmental perspective. You're talking about like at each stage of development throughout their growth, you're looking at some basic functioning and basic markers and milestones that really gives you as a pediatrician a sense of are things on track or not. And that's what makes pediatricians such a valuable partner with parents. And so, you know, as a pediatric psychologist, I also know that low self esteem and social struggles can play a part in, you know, academic success and sometimes struggles that young people face. What are your thoughts about that?
I mean, I actually pull from my own experience with my son because he struggled early on with even just basic feeding issues. And when he got to the age where we could send him to preschool, we were really nervous about how he was going to behave with other kids. And so we focused on getting him into a preschool that we felt would work with us on his behavior and not just throw him out if he had one bad day or something. And I think that's important. But then also, as he went through preschool, we sort of kept an eye on other issues. And ultimately, we realized in early first grade, I think that he was really dealing with a lot of anxiety issues. And so as that came out, we were able to get him referred to a counselor. And then, he had different evaluations to see if he would, have ADHD or something like that. Or actually, in his case, he ultimately had a diagnosis which in medical school and even in my residency, I'd never heard of, called sensory integration or sensory processing disorders. So it's not really autism, but they kind of behave a little bit in that realm. Their behavior can be quite erratic. Sometimes when they're younger, they can focus on strange things, almost becoming obsessed with them. In some cases, it's like trains um, or dinosaurs or something. In his case, he didn't really have that, but later on, it was more like matchbox cars.
Yeah.
But we worked through those things, and I think we had to make sure his throughout that his speech was checked because some people couldn't understand him, we could understand him. So that I feel like I learned the most about that. And actually, one of the things the pediatrician did to help us was make referrals for us
Mhm.
because he wasn't eating. They sent us to GI experts, and because he was struggling, and we weren't sure if it was a neurology problem, we did get a referral to neurology. So I think pediatricians too, as they follow the kids over time, and I think listen to the moms and listen to the dads and the guardians, and have a lower threshold with those really young developing minds to refer early and not let the problem just completely get out of hand.
Yeah. I hear you speaking to the idea that, um, you know, there are partners in pediatricians who can help you pay attention to certain things that you don't immediately think are connected to how they're going to perform in school, but gives you a sense that addressing things like feeding, for example, or thinking about their behavior early on when they're small, and addressing it and getting referrals early can support them as they are going through their school age years.
Yeah.
What are some tools when you think about your son or his pediatrician or even your practice? What are some tools that help you pay attention to, you know, feeding or just screening for some concerns or normal developmental kinds of milestones that affect academic achievement?
Yeah, I think to start out, we're always looking, I mean, every pediatrician's looking at, weight gain, length or height, head circumference, and I think, we're looking at those measurements for the kids over time. So we're making sure that they're staying on those growth curves for good growth and also in the same time screening development to make sure that they're developing normal, meeting the typical milestones and knowing on the other hand that, there is variability. Not every child will sit up straight at 6 months old. So we know that there's some variability there, but if we get to 12 months and the child's not sitting, that's a big concern and we would, refer. Other things like making sure kids don't miss a lot of school. And to me, that comes down to immunizations and making sure that they're following the vaccine recommended like procedure outline, if you will, from the CDC or the AAP, which pretty much is outlined every year around the beginning of the year to make sure that any new ones are added. Around the time they start crawling, we usually look for anemia by checking a blood count or CBC, and we check a lead level because once they're mobile, they can start getting into stuff. And that's when we start worrying about lead or other kind of exposures. And then all along the way, if they're getting active in a sense, okay, are they riding a bicycle? Okay, do you have a helmet? Of course, we talk about car seats, proper fitting car seats, which direction they're supposed to be. But even beyond that, we talk about, seat belts. And as the kid gets older and older, okay, you decided you want your kid to play football. What's the situation with helmets? Are they properly fitting, etc. And then I think sleep, we can't forget about sleep and focusing on bedtime, having a regular bedtime. Some people call it sleep hygiene. I don't know if it's not my favorite term, but just going to bed, having a plan, and kind of sticking to that. And it can be hard. I know in the summer months it gets it gets dark much later. I think a lot of kids are naturally inclined to stay up a lot later. So we got to watch that in the summer.
Yeah. Well, this overall topic is very near and dear to you, Dr. McGrath, and you've implemented a special program here at Wayne Pediatrics to support literacy development and overall academic achievement. Tell us about why it was important for you to get this program integrated into the care provided at this practice.
Yeah, the program that we instituted is called Reach Out and Read, and it's a national program. It's one of the very few national organizations that's endorsed by the American Academy of Pediatrics because they're data driven and they actually have, their protocol is, approved and it works. It's been studied in various environments and clinics. And the Reach Out and Read model actually expanded this year. Since we even opened our clinic as part of the program, it expanded to now include giving new books that are age and developmentally appropriate to every child at every well visit, from their first newborn visit to the pediatrician all the way through through their 5-year well check. So that's a lot of books. It used to be 10 based on the well checks, and now it's actually 15. So that is really important to me because I think that just as a side note, I was able to get the most recent data on this issue as much as you can. It's difficult to find, real good literacy estimates, but the sort of closest caveat is the 3rd grade English language proficiency, which is assessed through, I think, the M-STEP test for the state of Michigan. And unfortunately for the city of Detroit, only like 16.4% in the year 2020 met that proficiency guideline. So 16.4 is pretty low for all 3rd graders. And as it even compared locally to Wayne County, it's like 32% met the proficiency. And for the state of Michigan, it was 45%.
Right.
So, I think we have a long way to go, and our patients that are primarily coming to our practice here at Wayne Pediatrics are probably mostly from Detroit. So I think encouraging literacy and using the Reach Out and Read platform to encourage reading, encourage the mom or dad to read to their child from the very first visit, I think it makes the possibility and the chance of them, reading to their child over time better. And we are excited that by the time they get through their 5-year well check, they might have up to 15 books that are age and developmentally appropriate. So they have a small library literally for each child. And, trying to find funding for that and stuff, it's a work. We get grants and things to try to cover the books, but they're all brand new and they're for each kid for every visit. The other thing that we do differently from some of the other clinics is our subspecialists here also participate in the program. So even if you're coming to nephrology or endocrine for diabetes or rheumatology, as an example, they are all able to get the books for any visit too. It's not just like regular or routine visits, but even if you come in for an acute visit. So we have, many opportunities to pass out books, and we don't stop really at 5 years. We have titles and developmentally appropriate books that go all the way up into the young teen, interests, kind of young adult interesting books And it does get harder though, the older they are, to find a, like a broad interest, because, the students might go off in different genres, or
Right.
they might like certain things, that are important to them. But we don't stop at the 5-year well visit. So we
Right.
really like to give the books all throughout.
Yeah, that's such an exciting aspect of what we do for our families and our patients. Any sense of how many books we've been able to distribute, or how many kids have been impacted so far?
Yeah, officially, according to our like inventory check marks, we passed out over 800 books in the first year of the program. And we know that, I know that it's more than that. I think it's probably close to double. A lot of times in the busy clinic, the pediatricians get moving and seeing their patients and very quickly going in to see the next one. And I'm very sure that they forget to check the little box that they took a book. So I can tell you, because I've ordered the books, and I know, and now since the pandemic restrictions have lifted to a large degree, we're having a lot of additional patients coming in and through the doors, and we've been using a lot of additional books. So we're not running low. We have a good supply, but we've had to make sure that we have a good backup closet, couple closets full actually.
Right. Well, thank you, Dr. McGrath, for spending time with us today to discuss how pediatricians can support children's educational achievements, and how Reach Out and Read is making a difference here at Wayne Pediatrics. As a pediatric psychologist, I've seen in my practice a range of conditions that can contribute to academic challenges, and ADHD, child abuse, speech concerns, bullying. And when a pediatric practice can partner and have a really whole child approach, where we're trying to support what traditionally might happen in a different setting, but is good for the overall development of the child, that's how we know we're really caring for our patients in a quality and important way. So I
Mhm.
encourage parents to be open with sharing behavioral concerns with your pediatrician, because pediatricians are effectively able to diagnose and or refer to further support how families are raising their children. So thank you for joining me today for Detroit Peds Talk. For more information about Wayne Pediatrics, please visit waynepediatrics.org, and also follow us on Instagram and Facebook for new shows posted monthly every Wednesday. And remember, pediatricians are the best option for the medical needs of children. Take care.